So, since RFK said, oh, let's look at more research on these vaccines, right? Everybody has been losing their minds. And it's actually a really bad look for healthcare right now, especially with all these doctors and advanced providers and nurses who are like, no, we don't need to study it. First of all, the basis of medicine is to study everything. Literally, the basis of medicine is to make sure we are performing evidence based practice. And evidence based practice means we have studied it. We have not studied these vaccines. We have not done multiple studies that can prove multiple outcomes. And we have not done studies to say that they prevent XYZ or that they have been linked to health issues. Okay, we haven't done the studies. Just put that out there. Okay, on the other side of this, before COVID, nobody really was that concerned about somebody's vaccination status. I've worked in healthcare for like over 10 years, okay? And I'm going to tell you, nobody cared. Nobody asked. Nobody was concerned. The reason I know this is because I haven't gotten the flu shot. I've never had the flu either. And I've worked in healthcare in that time. And I've had to wear the mask. Okay? Never had the flu. Okay? And patients would ask me, why are you wearing the mask? Well, I can't get the flu shot. Well, that's a stupid reason. Yeah, I know, but I'm not the one who makes the rules, babe. Sorry. So COVID happened. That was the only good thing about that is I stopped getting asked that question. So it was fun. But now everybody looks at me like a weird leftist nurse, and that's not as fun. But whatever. My politics don't come into my profession. The fact that everybody is so, oh, vaccines are the greatest medicine ever is really kind of scary because when people find out that their healthcare provider isn't vaccinated, they lose their mind. My healthcare provider's gonna give me measles. I'm gonna die. Baby, you can't get measles unless somebody has measles. Yeah. And if they don't have measles, you're not getting measles. You're not getting rubella. You're not getting mumps. You're not getting the flu. You're not getting hepatitis B. You're not just because somebody doesn't have the shot for it, which does not, practice against immunity and creating immunity, it just creates an immune response. That's the definition of vaccines, by the way. It just stimulates an immune response. Okay, if they don't have the disease, they can't give it to you. And the fact that we're not researching things to make sure that they are the best first-line treatment is questionable out there anyways. It makes you look ignorant, and it makes you look like you're trying to hide something. It makes you look stupid. Why? Because here's a couple examples of things that we decided after more research, it was better to try something else. Metoprolol used to be first-line treatment for blood pressure. Since we have studied it and found that it has actually a higher adverse reaction, it's dangerous to stop it suddenly, and it affects people who have asthma adversely, we decided that wasn't the best one. It also didn't help with organ failure that you could potentially have because you have different comorbidities that help with that. So we've decided on other medications. Okay, what about aspirin? We used to say aspirin was the best option for pain relief. Well, platelet aggregation was kind of, a problem. It also caused gastrointestinal issues like ulcers and everything else like that. So we're like, let's not do that. Then what about warfarin? Warfarin was first line. However, because patients were having adverse reactions because the therapeutic window is so small, and the frequency of the blood testing, they had to create another drug. So they use Eliquis instead. Now, Eliquis is stupid expensive, but that's first line. Okay, what about the most famous one? What about thalidomide? If we still continued using thalidomide, we'd have so many other issues. What about SSRIs? We have to tell women to stop taking them when they're pregnant because of cleft lip and cleft palate. We only learned these things after we did more research. So to say, oh, I don't want to research vaccines because it's already sound, shows that you're stupid and ignorant. And you don't care about anybody because you only care about the message. That's not a good look for medicine. I'm sorry.